Welcome to a comprehensive guide on CPT surgical global packages, focusing on separate procedures and unlisted code and special reports in medical coding. Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In this session, we will explore the significance of these codes and reports and how they impact the medical coding. Let's get started. CPT Global Surgical Package. To understand what a global package is, let's consider an example. Imagine you are vacationing at all-inclusive resort. Your room, food, entertainment, and transportation within the resort are included for a single price. This all-inclusive concept also applies to many surgeries, referred to as the global surgical package. A standard package of preoperative, intraoperative, and post-operative services. Just as important as knowing what is included in the global package is knowing when the global package begins and ends, and it depends on the type of procedure or service reported. There is two types of procedure: minor procedure and major procedure. Minor procedure are relatively simple and may have either a 0-day or 10-day global period. In minor procedure, the preoperative period is the day of procedure, with the postoperative period of either 0 or 10 days depending on the procedure. Major procedures are more resource intensive, require a longer recovery for the patient, and have a 90 days global period. Major procedures has a preoperative period of 1 day with 90 days for the postoperative period. Let's discuss about a separate procedure. In CPT medical coding, a separate procedure refers to a stand-alone medical procedure or service that is distinct from other procedure performed during the same encounter or visit. If a separate procedure is performed during a more extensive procedure in which it is typically included, it is not separately reported. If it is performed alone or with another procedure of which it typically not a part, it may be separately reported. If separate procedure is carried out in different session, procedure, surgery, sites, organ system, separate incision or excision, or in separate line or separate injury, then we will use the separate procedure with modifier 59. To understand this, let's take an example of shoulder arthroscopy. Code 29805 is a separate procedure code and is considered a diagnostic code. Code 29806 is a surgical code. If we diagnose the shoulder problem and then perform the surgery in the same session, we will not use the code 29805 along with 29806 because it is done during the same session. If we diagnose the problem of the shoulder in one session or day and then perform the surgery in another session or day, we will use the code 29805 for the first day and 29806 for the next day because both services are done in different session or day. Similarly, if the separate procedure services are performed on separate organ on same day, then they will be reported along with the modifier 59. A service date is rarely provided, unusual, variable, or new may require a special report. A special report should include An adequate definition, description of the nature, extent, and the need for the procedure, time, effort, and equipment need to provide the service. A special report is used when there is not a specific code available to accurately represent the procedure performed. These reports provide additional information essential for accurate coding and billing, ensuring that the healthcare provider receive appropriate reimbursement for the service rendered. When a service or procedure is provided that is not listed in the CPT book, an unlisted procedure code is used to indicate the service. For example, if a new surgical technique or procedure is performed for which there is no specific CPT code, the provider may report it by using an unlisted surgical procedure code. However, when using an unlisted CPT code, it is crucial for the provider to document the procedure thoroughly and provide a detailed description in the medical record to support the use of unlisted code for the accurate billing and reimbursement. In medical coding, an implant refers to any device or substance that is placed inside the body with the intention of remaining there for a prolonged period to support and enhance physiological functions. This can include things like pacemakers, stents, or even dental implants. On the other hand, a foreign body refers to any object or substance that enters the body from the outside and is not naturally present. Foreign bodies can be introduced accidentally or intentionally and may cause an harm or discomfort if not removed. Examples include bullets or even the medical devices that are migrated from their original location. Now it's time for our question and answer session.